So it is my humble advice for every patient of chest pain. First has to visit the nearest doctor or clinic and get ECG done. Whether this chest pain is typical of heart problem or something else than the heart problem. There are several other reasons of chest pain also, but we have to differentiate from the heart attack and other type of chest pains, and that has to be done only by the ECG and the proper clinical consultation. Whenever you get a fresh chest pain, it could be a heart problem, and we have to diagnose it on the basis of ECG. If ECG is normal, even though patient may need to do some other tests like 2D echoes, treadmill test, or troponin, CPKMB, like blood tests. So to diagnose as a heart attack or it's other than the heart attack. So this is very important to get visit nearest hospital. If there is a facility of doing ECG, get it done and get a proper consultation. Okay, thank you. When patient has a low BP, first, if it is a very low, like up to 190, some of the patient doesn't have any symptom signs also. The 100 is also okay for few patients. For few patients, it's 90 or below 90 is dangerous. Though that time patient may have the giddiness, lightheadedness, like while walking, patient may get blackouts or swing around, and when patients start or stand from the sitting position, patient may get a blackouts and syncope. We call it a syncope, that patient may fall down on the earth. So these are the signs of low BP. But initial level, there is a lightheadedness कि सर हल्का हल्का लग रहा है, वैसे like that symptoms may develop, and the angina, that chest pain patient may have to mm, mm, take a treatments like antiplatelets, aspirin 300 milligram, clopidogrel 300 milligram, and atorvastatin 80 milligram when patient has a chest pain. And for angina, if there is low BP, we should not give the sorbitrate, that a common tablet as advised by everyone to keep on below the tongue. That may also cause again low BP. So first get the ECG done, take a proper consultation. If there is a problem of heart, we have to start with the medicine. Or if low BP is symptoms, we have to take hydration, more and more water and salt drinking, so the BP will rise and the symptom will vanish. But ultimately, we have to consult the doctor nearest and get a proper treatment. Thank you. Anti-anginal medications are it is a important part of the treatment for the heart patients. Although it can be started on once patient had a heart attack or angioplasty or bypass. So these drugs, how they act, that we have to understand first. So they will dilate the blood vessel, make it a bigger, so blood flow through the blood will is increases and heart get adequate of blood supply. So these are the reason why we start anti-anginals to the patients, and some of the other anti-anginal which act on a different methods. When this occur, it also dilate the blood vessel in the brain. So brain will get more and more blood supply. So that can lead to the headache, migraine, or pulsatile headache. These are the side effects of these drugs. So what we can do for to avoid these drug side effects? So we can shift the drug to the other group. If there is a problem with the one group of drug, we can shift to the other group. And there are some other drug group which acts on different way, like a beta blocker, trimetazidine, ranolazine. This doesn't have any effect on the blood vessels or blood supply. So they don't have the side effect of migraine or headache. So we can shift to the other drugs like this.